remarks will address two questions. First, how might we view the Middle East impact of COVID-19 through the lens of human rights? And what can we say about the post-pandemic future of the Middle East, particularly in light of recent social upheaval in the region? So first, regarding my first question, I will consider three statements that come from the WHO, the World Health Organization, on health and human rights, and how they play out in the Middle East. And then regarding my second question, I would just really consider possible paths beyond COVID-19. So first, the right to health, this is my entry point, was guaranteed under the Universal Declarations of Human Rights. And over the years, it became so much more comprehensive. The WHO regard the right to health as a fundamental human rights, which include the right to access to healthcare, the right to access information, and the provision of discrimination in the provisions of medical services. So if I were to take just those three statements and to see how they play out in the Middle East, it will start like that. The individual have the right to access healthcare. Yes, of course, that's a very important statement, because what does the right to health mean? Already, the French labor activist Louis Blanc asked that question in 1848 during the cholera epidemic: if one does not have the material mean to access healthcare. The current pandemic already confronts the United States and other developed countries with that same old question, which becomes more acute as the virus spread into the developing nations and the world's crowded refugees camp. Healthcare facility in the Middle East, some of you have spoke about that, had already boosted infections control in response to the respiratory syndromes, MERS, which, as you all know, originated in Saudi Arabia in 2012. However, most countries in the region, with perhaps the exceptions of those in the Gulf, have relatively weak healthcare system and a fragile economic infrastructure with which to deal with the current crisis. So access to sufficient healthcare is a problem. Now, the second point of the WHO, which I'm just going to take those 3 points, is the right to access information. Government must prevent disinformation at all costs and provide timely and accurately health guidance. Now, if government should have taken one lesson from China's ending of the coronavirus, it's that limiting information and shutting down the debate in the name of stability or some form of collective security really carry grave risk and can be disastrously counterproductive. In the Middle East, Tehran has questioned or detained journalists who contradict or question official reports, warned that those publishing statistics other than government figures would be arrested, and issued censorship orders to new outlets. Even last week, the Prime Minister of Egypt, Mustafa Madbouli, warned legal action would be taken against anyone who spreads false rumor upon the pandemic. And that brings me to the third point that I want to highlight of the WHO, the prohibition of discrimination in the provisions of medical service. Now, we know that more than in the developed world, in the Middle East, discrimination in the provisions of medical service, in addition to the differences within social classes, might be expected to be a serious problem in the midst of warfare and large scale of refugee movement. For example, one should not be surprised that COVID-19 is exacerbating sectarian tension in the Middle East. Refugee International, for instance, says that at least 12 million refugees and internally displaced people live in Iraq, Syria, Lebanon, and Turkey would greatly suffer from a high death toll. Of course, we don't have all the number now, but that's sort of the prediction. And most do not have the privilege of physical distancing, sanitation, or even working from home, particularly if they are in camp. And so that takes me to the second question. What can we say about a post-pandemic future of the Middle East, particularly in light of recent social upheaval in the region? And so here are two opposite paths that are worth noting. And I will note that my fellow panelists focus on the first path. I'm going to do also the second. The one can expect authoritarian leaders to continue to grab powers in growing surveillance societies solidified by quarantines. COVID-19 has indeed strengthened authoritarian trends so far with emergency law intended to contain the spread of the virus. In the Middle East, with the spread of COVID-19, the Arab human rights protests of 2019, heralded as an echo of the Arab Spring, came to a halt. Citizens now find their movement tracked by mandatory apps on their cell phone, such as China, Israel, Singapore. But whether you are in Algeria, Egypt, Iran, Iraq, Lebanon, Morocco, Saudi Arabia, government have used the coronavirus as an excuse to suppress freedom of speech, ban demonstration, jail dissenters, and consolidate their power. Now, let me just, for the brief amount of time that is allocated, to just talk about the other paths, which the panelists have not yet discussed. The popular demand for civil and political and economic rights, which were expressed both during the Arab Spring in 2011 and through 2019, were not met. So now COVID-19 will propel 8.3 million people in the Arab region into even greater poverty. But against the authoritarian power grab in response to the pandemic, one can expect a new wave of social protest, revived with even more urgency after the immediate dangers has passed. And even a pandemic could lead to the new beginning by bringing to the forefront global concerns that have been overlooked in this populist and isolationist age. The times are today, I would suggest, more auspicious for meeting demands for human rights, both globally and in the Middle East. The continued popular demands for universal and nationalized public health, the appeal of, even now in the United States, of universal basic income, the development of a vast global corporations in science, addressing climate change, building a green economy, resisting sectarianism, and seeking political transparency have also made some inroads. Many of the current hardship in the future possibilities and the future possibility I've recounted, yes, in the recent book that I've just written, in the Levant Express. There I suggested possible path for the future of the Middle East, not for tomorrow, but 25 years ahead, based on basic human rights guidelines and drawn from post-World War II reconstruction effort. FDR, yes, we do need FDR, principle of freedoms for domestic and international politics, provide at the time a critical underpinning for European stabilizations and recovery after World War II. I would suggest the New Deal proposal applied in the Middle East context become even more relevant in a post-pandemic world. In my book, aside from account of the conditions that led to the Arab Spring and the derailment of human rights aspiration during the subsequent Arab winter, I discuss at length possible future paths based on civic, political, economic, security, and women's rights. This proposal will be especially important as human rights and economic security are very much at risk now after the pandemic. If we want to ensure that the path toward human rights is secure, I think that we really need to invite an urgent conversation about creating the condition for that second path with the Middle East, I don't know, connected by railways, road, trade routes, uniting financial, commercial, governmental interests, and finally fulfilling basic human rights. So finally, I would say that the Middle East is desperately needs American and Western assistance to advance the interlinked human rights precondition for long-standing stability. That was true prior to the COVID-19. It's even more so today. The viability of Western democracy in turn need a peaceful Middle East as an essential step toward halting the global refugee before and after the post-pandemic crisis. I would just add that Professor Kissinger just wrote this article of the Wall Street Journal, and if Kissinger really believed that this is the time to think about the post-pandemic and how to really revive a liberal international order, this is a realist. I'm a human rights professor. I think that if we can agree on this, maybe there is a more agreement that can come as a result of that. Thank you.